Thanks, Esla. All right, well, our first panelist today is Chris Barnett, who is the co-director of the Center of Applied Research in Environmental Systems at the University of Missouri at Columbia. And I have the magic tool here for you.
Okay, am I seated or?
Well, you'll be up here.
Podium, okay.
Yes.
That's great. Change of venue from yesterday, so you can all see me. Good morning. As co-director, assistant director, we've had a reorganization in titles and things. I'm involved with CARES at the University of Missouri. How's that? I'm here today to talk to you a little bit about one of the tools we've been working on, Community Commons. This is a joint effort between us at the University of Missouri and our center, as well as a nonprofit group called IP3, who does a lot of the sort of stewardship and marketing and user support for Community Commons, as well as a group out of Portland, Oregon called Community Initiatives, who does a lot of community-based work and relationships. CARES, our center, provides the data and technical support for the Community Commons. And I know that there's a few of you out there that know Community Commons, they're active users of that. There are a lot of you who don't. So I'll be giving a sort of basic introduction to the Community Commons today, and hopefully demonstrating how a platform such as this might be used to sort of carry on the communication and conversation of the intersection between health and transportation information. So, there we go. So what is Community Commons? Community Commons is a website supporting the conversation through group-based discovery, discussion, and shared resources, grounded in data and analytical tools that can lead to positive change in communities. So that's a brief introduction of some of our overarching goals for Community Commons. So what can you do on Community Commons? At the core of Community Commons is a national web-based set of data that we use to provide the engine for our analytical tools, for our mapping tools, and for a lot of the activities that folks do on this. We have information spanning a variety of topics, including things like education, poverty, health, and emergency management available through the system. And we have thousands of data sets available for mapping from a variety of mainly public sources for supporting the Community Commons. Now, the role we're playing with the general access to Community Commons is to help provide better access to that sort of secondary data source, things like the census data, the BLS data, etc., that you can get all in one spot through the Community Commons. Here's an example of how the Community Commons might work on the mapping side. Here I've chosen to bring up a map of predominant race ethnicity by block group from the Census 2010 data. I can interact with this map, show things like what's going on in the particular block group I've clicked on there, some of the data behind this, as well as see the distribution, spatial distribution of this information on the map itself. Of course, I can do things like zoom in to show more detail on the map, and I can interact with this map. Here I've chosen to bring in a couple other pieces of information and show them side by side. On my left-hand side, I still have my predominant race ethnicity information. On the right-hand side, I'm showing things like, what am I showing? Population below poverty, below the poverty level. And across both of them, I've displayed the public school information. So I can kind of see visually how things interact and intersect there between different data sets and some of the distributions on that. Now you'll note that I have shown on here a few of my schools I've selected. They're shown in red right now. And I found I've done a query on my data set. You have tools that allow you to query the data, export in more detail. So I performed a query on this. Say I've pulled up schools with more than 90% of the students receiving free and reduced lunch. I can look at that spatially. I can also pull up the information behind that and show that data. So here I have a little spreadsheet of the schools that met my criteria. At this point I can do other things like download that information for further use within my own analysis, etc. or continue to do my further exploration on the commons itself. Should be said back here, I don't really have a slide of it, that we have a couple other features that you can do with the commons at this point. One of the things we have you do whenever you come to Community Commons is register to use the maps and data that you will find on the system. Now, through that registration, you can share, you can save all these maps that you're seeing on the system. Once you've gone to the effort to pull from the thousands of data sets we have and construct a map that you would like to have, you can save that to your account. Come right back to that. It'll be in the same location with the same information, and if you've chosen to symbolize it differently, it would be symbolized in that way as well, so that you can return to that map. Now, well, I'll get into some of the other activities you can do with that here in a minute, but the point is that you have a presence on the commons once you've registered for it and can come back and do things quickly and easily rather than starting over from scratch every time you approach the data. So beyond just the mapping tools and that sort of core data engine that we use for the mapping, we can use that same data engine for a lot of other activities on the commons. Some of the things you can do that we try to do is to help provide access to tools and visualizations that provide meaning to that data within that data engine. I'm going to go through 4 different tools that we have available. Hopefully it'll give you some idea of the types of things that you can do on the Community Commons. The first one that's probably been around for about 3 or 4 years now is our vulnerable population footprint. This was a tool that we worked on in cooperation with the Public Health Institute of California, several folks out there, and we wanted to say, well, is there some sort of simple screening that we can do with the data in the public arena? In this case, we're using census data. Is there some sort of simple screening we can do to help us get a quick snapshot of where maybe in the community some of our most vulnerable populations are? And through some of the research that they did, they said, well, a couple of quick and dirty things to look at would be number of folks in poverty and the number of folks with lower educational status. And so we looked at those to help us define those most vulnerable to health-related issues, either health access, having health insurance, a variety of things that might impact health condition. So we took and we mapped here in orange. You see the percentage of people, percentage of the population in the tract with living below the poverty level. Here I've mapped 20% or more of the population. Each one of the tracts in orange is below the poverty level. In the purple are the tracts with 20% or more of the population having less than a high school diploma in terms of educational attainment. And then in the red is the intersection between those two, where those two factors compound to show the most vulnerable areas within my map. We have presented this as a sort of interactive tool. You can grab those little indicator thresholds, move them back and forth to tailor that to your particular neighborhood, because certainly those thresholds would be different in maybe downtown Atlanta or Baltimore versus rural Minnesota. You know, you might want to have different thresholds to help you highlight and bring out areas of greatest concern. Once I have defined my area, I can do a couple other things with this. I can, for instance, make a vulnerable populations demographic report. It'll take those areas I defined in red, show them on a map again along with my definitions that I used for this particular report, and then you scroll on down through the report and you see things like the population in the area, some of the demographic makeup, things like linguistic isolation or below poverty level, etc. that you can access quickly and easily through this type of tool. Help you describe the areas in your community and quantify those areas that maybe you're targeting for any kind of project. Now, another tool is kind of the inverse of the vulnerable populations footprint. This is a location opportunity footprint that we were invited to participate. Oh my goodness, 2-minute warning. Invited to participate with a group from the White House with about 12 other groups across the nation to use data released by the Housing and Urban Development as well as EPA and put together some tools that might show the use of this information. One thing I want to point out in this tool is it does, what this tool does is try to find, based on the data sets, areas of greatest opportunity for maybe living or conducting business. And we have in the darkest purple the areas that meet all our thresholds. Indicators on this would include school proficiency, number of nearby jobs per worker, as well as housing and transportation costs. A couple other tools, Community Health Needs Assessment tool. This tool is intended to provide sort of a base set of secondary information for starting your community health needs assessment. We had somebody stand up after seeing this and say, hey, great, my job is done. And their director stood up and said, no, now you've gotten all the secondary data out of the way, your job's just beginning. Now you can actually go into your community and conduct your health needs assessment, get all that local information, not having to worry about this, get this in 2 minutes, get this out of the way, go on and do your real job. And that's kind of what we do. We try to provide context for this, providing state and national context at the bottom of the table, as well as dials and maps and indicators indicating sort of context for the information that you're provided. I'm going to skip this right now and move on to the more powerful thing you can do in Community Commons is participate in a collaboration hub. This is kind of elevating you beyond the data into actually carrying on that conversation I alluded to at the beginning. You would come together and form a group would create a hub, and within that hub you can do things like share information, share ideas, maps, data, etc. Upload your own data into the system that will theoretically interact with other hubs and lead to a coherent sort of conversation across many different platforms and groups within the Community Commons. So within the hubs, like I said, you can share strategies, best practices, tell your own stories, get your point across for the thing you're trying to show. You can do things like integrate your own mapping data, tabular data, upload things like PowerPoints, PDFs, etc. to share with your group. We also have groups that are, through the use of the hub, are able to take the information on Community Commons and embed it in their own websites. Here you have Palm Healthcare has taken our mapping tool and put it in their own website, added their own data to it, and they're able to leverage the power of the Community Commons within their own area. And that's the Whirlwind Tour, communitycommons.org. Go online, you can find out more there. Thank you very much.